Welcome to Parenting with Care with Dr. P, the podcast where we provide insights and advice to help you navigate the challenges of raising happy and healthy children. I'm your host, Dr. Tamir Pielse. I'm an associate professor, core faculty, and child track coordinator for a doctoral clinical psychology program. I'm an author, a clinician, a mother of two, and I've also served as a clinical and adolescent inpatient program director for one of the nation's largest psychiatric hospitals. Today, we're delving into a critical topic that affects many families: pediatric depression and anxiety. Our goal is to offer you a comprehensive understanding of these conditions and equip you with the tools to support your child effectively. So let's get started. So, what is pediatric depression and anxiety? Depression and anxiety are not just adult issues. Children and adolescents can also experience these mental health challenges, and their effects can be just as profound. According to the Centers for Disease Control and Prevention, otherwise known as the CDC, approximately 4.4% of children aged 13 to 17 years of age have been diagnosed with depression. That's approximately 2.7 million children. About 9.4%, approximately 5.8 million, have been diagnosed with anxiety. That's millions of children affected across the United States. The CDC also reports that the suicide rate amongst Black youths aged 10 to 19 surpassed that of their white peers for the first time in 2022, increasing by 54% since 2018. The reality is that children may not always express their feelings in the same way that adults do. They might show signs of distress through behavioral changes, their academics decline. We see some physical symptoms like headaches and stomach aches. It's important to highlight that depression and anxiety can manifest differently in children. Pediatric depression is more than the occasional sadness and tears. It's persistently feeling sad, having a loss of interest that can affect how the child thinks, feels, and behaves. Anxiety in children is characterized by excessive fear or worry that can interfere with their daily activities. So, how do you recognize the signs and the symptoms? Recognizing the signs of depression and anxiety in children can be challenging because they often manifest differently, as I mentioned, than in adults. So here are some key indicators for you to watch out for. When looking to see if maybe possibly your child is experiencing symptoms of depression, some of the things to look out for would be persistent sadness or irritability, like they're easily irritated and frustrated. Loss of interest in the activities they enjoyed, so they no longer want to go swimming, and you know that they're an avid swimmer and they love the pool, they love the water. Or maybe this is a young person who enjoys spending time with their friends outdoors and they're like, not even interested. Changes in appetite or weight. For young people, they could be, you may see a change in their weight in the sense that they're losing weight, or they may be gaining significantly 5 to 10% more within a month's period of time. We also may see difficulty in sleeping, where they're sleeping too much, sleeping too little, or not at all. They have fatigue, low energy. They struggle to concentrate. And so this is extremely important for those who are in school, for example. If you have a young person at school and they're unable to concentrate, it's definitely going to play a role in how they perform, and their grades may suffer. We see feelings of worthlessness or excessive guilt and thoughts of death or suicide. When looking for signs of anxiety in young people, some of the symptoms that you may want or signs that you may want to look out for is excessive worry about everyday activities or events. Not being able to be, for example, one who's going to hit the presentation out of the park, or not going to be able to perform on the piano during a recital. A whole slew of worries that they have connected to their everyday activities or events. They may avoid social situations, have physical symptoms like headaches, stomach aches, or muscle tension. This can also cause them wanting to avoid going to school. They may be restless or easily fatigued, also trouble with concentrating and have some irritability. And we may see also some changes in their sleep. So if you notice any of these signs in your child, it's important to take them seriously. It's important to seek professional help. What we know is that early intervention can make a significant difference in how your young person thrives and lives out their best life. So if you're wondering, well, how can my child be struggling with this? What are some of the causes, some of the risk factors? Understanding the causes of pediatric depression and anxiety can truly help you better support your child. These conditions can often result from a combination of genetics, so it's passed down generation to generation, environmental, so the environment that they're in, maybe the school environment, the environment at home is a stressful one for that child, and some psychological factors. Children with a family history of depression or anxiety are at higher risk to developing this condition, any one of them. Stressful life events such as parental divorce, bullying, or trauma can also contribute. We also know that the child's temperament and coping skills play a role in how they manifest some of these conditions. Statistics also show that certain groups of children are more vulnerable. According to a CDC study looking at Black children, they're more vulnerable and are more likely to experience severe symptoms of depression and anxiety compared to their white peers. And unfortunately, they're less likely to receive treatment. So this disparity highlights the importance of awareness and access to mental health resources in communities that are typically underserved, underrepresented, and disenfranchised. So you might be asking yourself, well, how do I seek support? What should I be looking for, Dr. P? If you suspect your child is struggling with depression or anxiety, the first step is to consult with a healthcare professional. This could be your child's pediatrician, a child psychologist, a psychiatrist, or a psychiatric nurse practitioner. They can conduct a thorough assessment and recommend appropriate treatment options, which may include therapy, medication, or a combination of both. We know that cognitive behavior therapy, CBT, is highly effective for treating anxiety and depression in children. It helps them develop coping skills, challenge negative thought patterns. We also know that there are other, what we would call evidence-based treatments. So these are treatments that have research to support them, to back them up, that they work, that can be effective. They've been shown to be effective in supporting and treating children with depression and anxiety. And some of them would be interpersonal therapy, IPT, and dialectical behavior therapy, DBT. In some cases, medications may be prescribed to help manage symptoms, especially if they're severe. What it's important to know that it's beneficial to also involve your child's school. School counselors, teachers can provide additional support and accommodations to make sure your child can be the best them that they can be, and for them to succeed academically and socially. So you are seeking treatment from professionals. There's also a role for you to play at home. Beyond professional treatment, there are several ways that you can support your child at home. And I'll list off a few of them here. Number 1 would be open communication. Number 2, routine structure. Number 3, healthy lifestyle. Number 4, stress management. And number 5, positive reinforcement. So let's break down some of what I've just mentioned. Open communication. You want to encourage your child to talk about their feelings. And as parents, oh my goodness, you sometimes want to swoop in and save them. But the real important thing to do in this moment when they are sharing their feelings is to listen without judgment. Listen without being critical and validate their experience. So if this is not the good time, it's not a good time to say, don't worry, you'll get another boyfriend, you'll get another girlfriend, they're a loser anyway. Even if that is how you feel, or this is not the moment. Validate their experience. Let them know that you hear them. You could say things such as, I can only imagine how hard this must be for you to have to break up with someone you really thought you liked a lot. Validate their experiences. They're walking in their shoes. Help them feel like they have been heard, that you understand them to some degree. Routine structure. First, I tell my students this in the classroom all the time. Kids are not going to say, give me structure, give me structure. If anything, they're going to buck at it. But the reality is that they benefit and they thrive with structure and routine. So you want to maintain a consistent routine to provide a sense of stability and security for your young person. You also want to encourage a healthy lifestyle. So ensure that they get regular exercise, they're going outside and playing, have a balanced diet and adequate sleep. This helps with stress management. So not only nutritionally and sleep patterns can help with stress management, but also teaching them some relaxation techniques such as deep breathing, encouraging prayer, taking part in meditation and yoga. And then finally, positive reinforcement. So you want to celebrate their victories, celebrate their progress, no matter how small it may seem or minor it may seem to you. The reality is they've probably put their best effort, all of their energy into addressing whatever was put on their plate. And so to them, it's a big deal. So to have mom, dad, grandma, aunt, uncle, etc., recognize their victory, their progress, it is worth celebrating. The reality is that children are going to do what we do and not necessarily do what we say. So parents should model healthy coping strategies, maintain an open and supportive environment. It's important to remind your child that it's okay to ask for help and that they're not alone. Pediatric depression and anxiety are challenging, but with the right knowledge and support, parents and caregivers can make a significant positive impact on their child's mental health. Remember, seeking help is a sign of strength, not weakness. If you're concerned about your child, don't hesitate to reach out to a mental health professional. Thank you for joining us on Parenting with Care with Dr. P. If you found this episode helpful, please share it with other parents and caregivers. For more resources and information, visit our website at www.serenityforyouithandfamilies.com. Until next time, take care of yourselves and your loved ones. This has been Parenting with Care with Dr. P. Subscribe to our podcast for more episodes on parenting tips and mental health. Goodbye.